Good afternoon. Let's start with the pep talk now. I'd like to welcome everybody to this pep talk this afternoon, April 29, 2023. So as a reminder, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. Another reminder, after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. Certificate on ROJoson PEP talk, head and neck cancer awareness. Okay, so I have placed, and Abet has placed the link in the chat box already. Another reminder, getting 50 OLETE certificates will entitle one mentee to a free voucher for a ROJoson telemedical consultation like this. So some of you have availed of it already. Another reminder request will be please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your faces now. Show your faces. Charlie, okay. Tumambing, are you joining us for the picture taking? Okay. One. Okay. One. Okay, get ready. 1, 2, 3. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. And just to tell you, by May 15, 2023, this year, we're now celebrating the 2nd anniversary of the ROJoson PEP Talk. My PEP Talk today is entitled Head and Neck Cancer Awareness. This is in consonance with the Department of Health Awareness Calendar. The last week of April is considered as, has been declared as the Head and Neck Consciousness Week, the last week of April. Okay. So the empowerment objective of this particular pep talk is for the lay people to have a basic understanding of the common head and neck cancers in their health management. We know that there are a lot of head and neck cancers. We will just focus on a few, about 4 common head and neck cancers in the Philippines. The contents will be the following: when and what is the Head and Neck Consciousness Week in the Philippines? What is the head and neck? We will define that. What are head and neck cancers? What are the different types? What are the common, more common? As I said, there are a lot. We will just focus on the more common ones. And what are the different causes of the head and neck cancers? What are the realistic methods of prevention? And how to recognize common head and neck cancers so that we can promote early consult and treatment? And what are the usual diagnostic procedures, treatment procedures, And then what are my health advice on the prevention and early detection of head and neck cancers on a individual level or personal level as a lay person. The last week of April, as I mentioned, has been declared as the Head and Neck Consciousness Week. This is the result of a presidential proclamation 1676 in 2008, which initiated this Consciousness Week on head and neck. As written in the promulgation document, this event aims to increase the public awareness on the cancers of the head and neck region, so which includes oral cavity, nasopharynx, larynx, and thyroid. So the mere fact that these 4 cancers were mentioned, so most likely these are the more common ones in the Philippines. Cancers of the oral cavity, nasopharynx, larynx, and thyroid. And the other aim is to promote primary prevention, screening, and early detection and optimal treatment and care of patients with head and neck cancers. So the name given for this week is just Head and Neck Consciousness Week, but the specification in the aims will be on the head and neck cancer. So I just think that a better term, a better title for this will be the Head and Neck Cancer Consciousness Week, because based on the aim focusing on the head and neck cancers, we just call it Head and Neck Cancer Consciousness Week. That's a better title. In the US, here we have the week. We are celebrating it in terms of week, but in the US, they are celebrating the head and neck cancers in terms of month, a month-long celebration awareness program, advocacy on head and neck cancer for the whole month of April. So what is Head and Neck Cancer Consciousness Week in the Philippines? So this is a week to make people aware of the cancers of the head and neck region, particularly oral cavity, nasopharynx, larynx, thyroid, and to promote primary prevention, screening, or early detection and optimal treatment and care. And also, this is a week of empowering the people on the common head and neck cancers. So we are contributing to this cause in part of our patient empowerment program. Let's define what is head and neck. Okay. Head and neck refers to the regions in the human body, the so-called head and neck region. The head is the upper part or the uppermost region of the human body, yung pinakaitaas, when the person is in a standing position. The neck is just below the head and connects the chest to the head. Okay, so below the neck would be the chest or the thorax. So head, neck, and chest. So these are regions. Okay. Now, on the surface, so one might ask, what is the dividing line between the head and the neck? Okay, there's no definite line, but we just have to draw a horizontal imaginary plane just below the jaw, the angle of the jaw, the mandible. Okay, and this will be designated as the boundary between the head and the neck region. So all parts of the human body above this imaginary line, imaginary plane, belong to the head region, and those below this will be the neck region, but above the chest area. But it must be emphasized that the boundary designation is not uniformly contained in one plane. There are some organs here in this boundary which might be considered as part of the head or part of the neck. Okay. So this imaginary plane is just used as an operational designation by the medical scientists. Within the head and neck regions are organs and specialized tissues. So there are different specialized tissues and organs in the head. There are also different specialized organs or tissues, organs and tissues in the neck. The key organs and specialized tissues within the head region will include the scalp and the hair, the skull, the bungo, the brain, facial skin and soft tissue, facial bones, eyes, ears, nose, mouth, the throat, which are divided into several parts. You have the upper throat, usually at the back of the nose. We call that nasopharynx. And then the throat is at the back of the mouth itself, the oral cavity. We call that oropharynx. And then you have the upper jaw and the lower jaw. Okay. The upper jaw is called mandible in medical terms. The maxilla, the lower jaw is called mandible. And then the specialized tissues are the lymph nodes, blood vessels, nerves, and muscles, which can be also found elsewhere in the entire body. Now, cancers can arise in any of these organs and specialized tissues. So it can arise in any of the parts that I mentioned in the head area, and it can also arise in the neck area. Okay. Cancers can arise in these organs, specialized tissue, in the neck. Okay. So the key organs and specialized tissues in the neck consist of the following. So you have the neck skin and soft tissue, the lymph nodes, the thyroid gland in this area, the center. Parathyroid glands, these are small glands behind the thyroid glands. The trachea or the windpipe, daanan ng hangin. Then the lower throat will be the hypopharynx. Then the esophagus, the neck part. Okay. This is the esophagus is long. It has a part on the neck. It has a part on the chest. So that part of the part of the esophagus that is within the neck will be considered as the neck organ that can be involved in cancer. Then the specialized tissues will be blood vessels, nerves, and muscles. What are the different types of head and neck cancers? As I said, the head and neck organs and specialized tissues can be affected by any cancer and by different types of cancers. So the types, we classify the types into one, cancers based on the location of the cancers in the head and neck. Okay, so you can say cancer of the scalp, cancer of the skull, cancer of the brain, cancer of the eyes, cancer of the upper jaw, lower jaw, etc. So based on the location. Okay? So if it's located on the nose, we call it cancer of the nose. If it's located in the throat, oropharynx, we call it oropharyngeal cancer. Now, in the neck region, we also say if a cancer is arising from the thyroid gland, we call it thyroid gland cancer. If it's arising from the esophagus neck part, we call that cancer of the esophagus. Or lymph nodes in the neck area can also give rise to cancers. Another way of categorizing the type of head and neck will be based on the cells of origin. So you have special cells in that particular organ, squamous cell carcinoma, basal cell, melanomas. In the thyroid, we have different types of cells also. Cancer cells, those arising from the papillary structure cells in the thyroid will be called papillary thyroid carcinomas, then follicular thyroid carcinomas, and then the other types will be based on cell of origin will be the lymphomas, which arises from the lymph nodes, and sarcomas arising from the mga fibers of the neck, of the head and neck. Now, what are the more common head and neck cancers in the Philippines? So as mentioned in the declaration, proclamation, okay, specified thyroid cancers, nasopharyngeal cancers, oral cancers, and laryngeal cancers are the more common cancers in the Philippines. Okay, so nasopharynx, as illustrated here, this is the nasal cavity, the nose, nasal cavity. So at the back of the nose, that's the nasopharynx. No? And then the oral cavity, that will include the lips, the tongue, all these areas. Now that will be the oral cavity. And then the thyroid cancer will be in this area. Okay. Laryngeal cancer will be here. Okay. So cancer of the voice box will be called the laryngeal cancer. So what are the different causes of head and neck cancers? Basically, genetic mutations, so it can be hereditary or spontaneous. Majority are spontaneous. Only about 5% or to 10% at most are hereditary. Then the other major causes of head and neck cancers are smoking, alcohol, virus, and radiation. So some of these causes are preventable. Example, avoidance of smoking and alcohol can prevent cancers of the head and neck. But some are realistically not preventable. Example, the gene mutation, hereditary aspect of the gene mutation may not be easy to prevent. Okay. So what are the realistic methods of prevention of head and neck cancers? Okay. So when you say realistic, those that we can avoid, we can modify. So healthy lifestyle is one method. Hygiene, because we can try to avoid all the viral infection there. Healthy diet, then avoidance of smoking, avoidance of excessive alcohol, and vigilance against known risk factors as research will keep on going on. So we will be knowing more of the other risk factors. So we must know them and we try to avoid them. How to recognize the common head and neck cancer so that early consult and treatment will be promoted. Let's start with the thyroid cancers. Okay, the alert symptoms here. What are the cues? Yung mga red flag. Okay, red flag for thyroid cancers. Okay, one is nodule, one nodule or multiple nodules, 2 or 3, lumps on the front and central neck. Sa harap, no? Sa harap ng neck. On the front and central neck. Dito sa gitna. Then nodule or nodules on the side. Sa tabi naman, which are lymph nodes. Usually lymph nodes. When you have a nodule on the thyroid gland itself, then you have lymph nodes on the side of the neck. Then it's a red alert sign for a cancer because it seems that the primary thyroid cancer has spread to the lymph nodes. Okay. Then hoarseness of voice in the presence of the central neck lump. Okay, so if you have a thyroid nodule that has in which the patient is also has hoarseness of voice, that's a sign of invasion of the thyroid cancer into the nerve. As we know, cancer invade the surrounding tissues and they also spread. Okay. Now for nasopharyngeal cancer, the alert symptoms will be nodules on the side of the neck below the ear. Usually it starts from inside, but it's hard to detect it here. No? So you can see that this is the nose, at the back of the nose, this is the nasopharynx, it's there. Okay. So most of the time, the patient doesn't feel anything until it becomes big enough to cause symptoms. So usually the first symptoms that we get is that it has already metastasized to the lymph nodes. Okay. So once you have lymph nodes in this area, which are lymph nodes below the ear, now at the level of the nasopharynx, then we think of possible nasopharyngeal cancer. So if the mass of the nasopharynx is big enough as to cause symptoms, okay, it can cause nasal stuffiness and even nasal bleeding. So if you have nasal stuffiness and nasal bleeding, we also think of possible nasopharyngeal cancer. Oral cancers, alert symptoms, nodules, lump or lumps on the oral cavity. Okay, as mentioned earlier, these are the components of the oral cavity. You have the lower lip, the floor of the mouth, the tongue, the tonsils, the uvula, the soft palate. The soft palate, strictly speaking, it's not part of the, by medical terms, soft palate is part of the oropharynx already, but the hard palate is still part of the oral cavity, and then the teeth and also the upper lip. So another alert symptom would be nodules on the side of the neck, which are lymph nodes, which could be suggestive of a spread from the cancer of the oral cavity. The last more common cancer of the head and neck would be the laryngeal cancer. The alert symptoms would be hoarseness of voice. Okay. Larynx kasi voice box yun. So if you have mass there, you're gonna have a hoarseness of voice. And then again, nodules on the side of the neck, which could be lymph nodes, which could be a which will be suggestive of a spread from another source, which could be the cancer of the larynx. Now, what are the usual diagnostic procedures and treatment modalities for the common head and neck cancers? For the diagnostic procedures for thyroid cancers, usually ultrasound, then biopsy, then if needed, CT scan and MRI. And the treatment procedure for thyroid cancer, usually surgery is the the first treatment of choice. Then radioactive iodine therapy can be added if there are indications that, let's say, the thyroid cancer is very extensive, that surgery will not be adequate. Okay. Then for nasopharyngeal cancer, the diagnostic procedures will be, kasi nasa loob siya, so hindi kagad makikita, so endoscopy. So a tube will be inserted through the nose, inside through here, and then take a look at this area, nasopharynx. If the mass is seen, then a biopsy is taken. So this is the most common diagnostic procedure being done. Now, if they additional tests can be done like CT scan and MRI, if the extent of the nasopharyngeal cancer will have to be determined exactly so that it will guide the treatment. Now, treatment procedures, usually we don't operate on this area. Okay, so usually it's a combination of radiotherapy and chemotherapy. For oral cancers, diagnostic procedures, usually kitang-kita naman yan, pag may bukol dyan, may mga masses dyan, usually biopsy is the first, the most common diagnostic procedure being done. Then, endoscopy, kung malalim siya, nasa loob siya, let's say a little far from the boundary of the mouth, then endoscopy will have to be done. Then CT scan and MRI can also be done to determine the exact extent of the tumor, kung saan siya kumakapit. Na? Treatment procedures, the usual treatment there, the most common, the primary treatment, still surgery, if it can be done early enough. Then this is usually followed by radiotherapy, and sometimes chemotherapy can be added in case that surgery and radiotherapy will not be adequate. Now, for laryngeal cancer, the diagnostic procedure will be a scope because malalim siya sa loob ng mouth, sa throat. No? So endoscopy, the specific term for this endoscopy is laryngoscopy. Okay. Then with a biopsy, if there's a mass there, and then again CT scan and MRI to determine the extent of the cancer. Treatment procedures, usually the primary, the first choice, usually surgery, especially if it's small. If it's big already, then surgery may not be the adequate, will not be the recommended treatment of choice anymore. Then radiotherapy will have to be done. And then if really needed, chemotherapy. What are my health advice on prevention and early detection of head and neck cancers on an individual level, okay, on a personal level, on the lay person level? So number one, no smoking. No smoking. I won't say as much as possible. Totally wag na lang. No smoking. No alcohol. Since you cannot avoid, kamisan, you cannot avoid, but drink this in moderation. So, but as much as possible, no alcohol. Then hygiene, of course. Hygiene will be especially yung mga viruses that can cause head and neck cancer. Now, for early detection, so you must know the alert symptoms which I just presented earlier, and then do the monthly head and neck self-examination. Kapa lang, look and kapa, and then feel your body for any symptoms. And then once you feel something unusual or saw something unusual, you consult a physician as early as possible. So this will promote early detection and treatment as well. So below are samples of pictures of head and neck cancers or tumors muna, okay, which can be cancer or not cancer, that when familiarized just by looking at each pictures, it can give you some idea already what head and neck cancers usually look like. And then by recall, you might be able to recognize them once you see them. So it may facilitate the persons doing a thorough self-examination and may assist in deciding on the urgency of consulting a physician. So this one, you have a mass on the scalp. Okay. So nakikita niyo yung bukol nito, ugly looking mass. Okay. So when it's really ugly looking mass, fleshy, most likely this is squamous scalp cancer, skin cancer of the scalp. And the most common type here is the squamous, the specific type, squamous cell carcinoma. Another example of scalp tumors, you have an ugly looking mass here. Ayaw gumaling. Okay. So non-healing wound here, non-healing lesion. Kaya we suspect cancer. So a biopsy was done. So it turned out to be squamous cell carcinoma. So this is how the operations is usually being done. Surgery, malaki ang margin para hindi mag-recur. And then dito sa baba, kumisa pumupunta sa neck, sa lymph nodes. So tinatanggal yung lymph nodes. So the operation will end up this way after removal of the cancer. Okay. And then of course we have to close this. So one way of closing this is to do skin grafting. Another example of a facial tumor dito, ugly looking, but fortunately this turned out to be a wart, a big wart, a verrucous vulgaris. Fortunate for this guy. Okay, so we just have to excise that warty tumor of verrucous vulgaris and then do the reconstruction. This one is just a drawing to show how the skin can be burrowed or advanced this area para may sara dito. No? Face tumors, again, you have example here, a mass here. Okay. Another one is here. So this turned out to be basal. Usually sa face, basal cell carcinoma is more common than squamous cell carcinoma. So pag tinanggal na yan, may uka na yan, so we have to reconstruct para may balat siya ulit. So this one, we just borrow some tissue from above, then rotate it down. Then, ito, binaba na. So it will, okay. So this is another patient, I guess. Okay, this is another patient, okay, in which there's a reconstructions here. Okay. Melanoma. Yung mga black tumors, usually very suggestive of melanoma cancer. Then maxillary tumors, yung mga upper jaw, bukol dyan. Usually, initially, walang nararamdaman. Pag nakita mo na yung bulge, usually we suspect upper jaw cancer. Okay. Usually, x-rays have to be taken. Okay. So another example of maxillary tumor, bukol dyan, and then we have to remove the entire tumor here, then put a mga prosthesis para hindi siya lubog. Okay. Then another example of maxillary tumor, the upper gingiva is part of the maxilla, upper jaw. So we remove that, then we using this incision, we remove it, and then reconstruct. Lower jaw, mandibular. Okay, usually we have to take an X-ray to take a look at the characteristic of the tumor. Okay, so this turned out to be a benign one, ameloblastoma of the mandible, which is very common. Okay. Mucocele of the oral cavity, as I mentioned, the lip is part of the oral cavity, so you have mucocele of the lower lip. So we just excise this. But this one, an ugly-looking lesion, this is squamous cell carcinoma or cancer of the lower lip. So reconstruction can be done after removal of the lip. Okay. So the smaller the tumor, mas madaling i-reconstruct. Macroglossia, congenital one, malaki ang mouth, tongue. And then this one is a cancer of the tongue. And then this one is granuloma pyogenicum. Palagi niya kakagat yung dila niya, kaya ayaw mag-heal ng maganda. Yeah, it turned out to be a small tumor that is called granuloma pyogenicum. Nasopharyngeal cancer, I showed a picture earlier. There's a there's a mass inside the nasopharynx, it has spread to the neck nodes. Once we see neck nodes like this in this area, we start suspecting nasopharyngeal cancer. Kung yung mga neck nodes sa baba, usually hindi. Ibang usapan yun. Okay. Laryngeal cancer, another common head and neck cancer, usually sa larynx, no? Dito. So this is after removal of the entire larynx, no? So wala na siyang voice box, so hindi na siya makakasalita, no? ng normal. And then, since dito ang daanan ng hangin, so we have to, since sinanggal na yan, we have to bring out the, yung sa baba ng trachea into the neck. So dito siya hihinga. Dito papasok, hindi dun sa itaas. No? Dito papasok yung hangin. Okay? Then cervical esophageal cancer, as I mentioned, is the esophagus is long. So you have the neck part and the stomach and the chest part and the stomach part. So this is part of the neck of the esophagus. So you can see the shadow of the tumor there. So yung pasyente hindi nakakakain because barado yan. Barado yung daanan ng esophagus. Okay? So a clue that you're dealing with cervical esophageal cancer is that the patient is experiencing difficulty in swallowing. Another type of cancer on the head and neck, dito. Okay, so you have dito sa may parotid area, sa tabi, below the ear. So this is parotid gland tumor, and then this one is below the mandible. This is submandibular gland tumor. So these are tumors of the salivary glands. Yung nagpo-produce ng saliva. No? Thyroid cancer, usually front, central part, masses, or even just one mass. This could be benign or malignant. Okay, and then example of a mass located in this upper part in a young boy. Usually, it's a congenital anomalies present since birth. So we call that thyroglossal duct cyst. This one, a neck mass, no? Okay, this turned out to be, so it has to be evaluated. This turned out to be TB of the lymph nodes. TB of the lymph nodes. This one has a thyroid mass with a neck node. So when you have neck nodes, we suspect thyroid cancer already. Okay. So my advice is to do self-examination of the head and neck regularly and thoroughly, at least once a month, because it's easy. It will just take you a few minutes, less than 5 minutes. Then do the self-examination of the head and neck will facilitate early detection of any diseases that may affect this part of the person's body. Once anything unusual is felt, is seen, or palpated, consult a physician as soon as possible. Early detection and treatment of head and neck diseases is associated with a lot of health benefits as higher chance of successful treatment and prevention of disfigurement. As I said earlier, the smaller the tumor, the better, the easier to reconstruct, okay, para walang masyadong disfigurement. And of course, avoiding premature death. Okay, kasi kung advanced na yung cancer, medyo mahirap na gamutin at usually, death is usually, the chances of death is usually high. So summary and takeaway, I have presented all these topics. Okay, I won't mention them anymore. Okay. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on head and neck cancer. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions in head and neck cancers in one's health management. So with that, I end my pep talk this afternoon. I hope I have empowered you to have a basic understanding or better understanding of the common head and neck cancers in your health management. Reminder before we go to the pep talk, to the QA, question and answer, will be to take the online or OLETE for mastery of learning and get a certificate like this. And then obtaining 50 OLETE certificates will entitle one to a free voucher for ROJoson telemedical consultations. Again, Please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking. Okay, everybody ready? Everybody? Last call, Susan, Therese. One. Nawala si Susan. Ayan, si Susan. Okay, 1, 2, 3. Okay, the floor is now open for questions, comments, consultations. Pwede rin. Okay. So again, 4 common head and neck cancers. You have the thyroid, number 1. Number 2 is nasopharynx. Number 3 is oral cavity. Number 4 is laryngeal cancers. Okay. So ang pinakamaganda dyan, pero depende sa stage also kung kailan yun nahuli, no? Ang pinakamaganda is still the thyroid, no? Okay. Walang masyadong disfigurement, no? Yung sa larynx, usually there'll be change in your voice, baka hindi na kayo makasalita ng gusto. Yung oral cavity, kung depende kung nasa anong lugar, kung nasa lips, sa labas, medyo may disfigurement na yon. Kung nasa loob, medyo hidden, no? So nasopharynx, usually late lang ang diagnosis noon kasi tago no? Okay. So any questions?
Doc, I have 2 questions.
Sure. Sino? Susan. Okay.
Susan, okay. I'm a person who has a lot of moles, small moles and everything. In fact, a major mole is on the lower right chin. It has been with me since siguro since I was in high school or ano. But every time I ask a doctor, is this cause for cancer? Sabi niya palagi, kung hindi raw lumalaki, okay lang naman daw. So, okay na sa akin yung ganon. And so far, it has been part of my face, no? But lately also, not lately, but 10 years ago, I also had this parang small wart naman, no? Which has the shape of the heart. So, sabi ko ba mukhang maganda to? What I'm more concerned with is the wart that has the shape of a heart. Is that cause for cancer or something?
Which the wart,
Yeah, I have here on my cheek. It wasn't here.
I'll enlarge you kung makita ko rito clearly, ha? Enlarge lang kita yung mo, speaker view lang kita, ha? Okay? Nasaan?
Ayan. So, it is the shape
why do you say it's a wart? Why do you say it's a wart?
Sino
nagsabi sa wart yan?
Ha?
Sino nagsabi sa wart? Ha?
Ako.
Ikaw lang. Gano'ng katagal na yan?
15 years.
15 years?
Yes.
Okay. Okay, yung sa baba, yung sa chin mo, that's a mole. Okay? Most
that's
likely,
a mole and
tama ka, no?
Yeah.
Tama ka. That's a mole, ha? Okay.
Yeah.
Pero ito sa taas, no? Okay. Paano ba yung enlarge? If I look at it, no? Okay. Medyo dark, di ba? Medyo dark. dark in color, brown or black?
Yeah, something
Yeah.
brown.
Brownish to black one. Okay. So,
So,
hindi naman lumalaki.
hindi naman, pero magandang shape niya, kaya ano, sabi ko sa'yo, ang shape niya parang heart eh. O
Mako-close
very
up mo ba?
positive lang ako. Ha?
Lapit ka nga sa sa camera.
Yan.
Sige pa. Konting side mo lang. Yan. Okay. So everybody take a look. Everybody take a look and give
It's
me your
big.
diagnosis. I want to have Okay. May pinost ako sa Facebook this week, no? Okay. So you can get a clue from there. Halos pareho. Ano yan? Anybody? Pa-diagnose natin sa member nating dito sa sa pep talk.
Seborrheic keratosis.
Yeah, seborrheic keratosis siya, no?
Ano yun? That's alien to me. What is it?
It's a type of a skin tumor, skin lesion, no, that comes with age. No, we don't know the exact cause, no. Okay. So usually medyo medyo slimy siya, waxy, and then the surface is not smooth, di ba? Okay.
Yeah.
And then pero yung border, kaya nga kita mo yung border malinaw, no? No? Okay. So in contrast, kasi pag black ang lesion, usually melanoma ang iniisip natin, di ba? Okay, yung cancer ng mole, no? Pero most likely it's not, no? So
It comes with age.
Yeah, it comes with age, no? Okay. It can occur anywhere, no? Usually sa face, sa abdomen, ganon, no? So earlier I posted a picture as I started a program, I call it Visual Learning in Health, okay? Visual Learning in Health to supplement my pep talk. There were a lot of people who answered, who interacted. I just asked them, give me your diagnosis. So some of them gave melanoma. Huh?
Is that on Facebook, the one you posted?
Yeah, the one on Facebook.
O baka YouTube?
Facebook. Nasa Facebook.
Okay, I'll look into that.
Okay. So based on this consultation, now just by looking, no, chances are it's seborrheic keratosis, okay, not melanoma, okay. So you don't have to have it removed. It's not getting bigger, but if you're bothered with it, it can be removed. You can put some yung tinatawag na yung isang pwedeng tanggalin, i-operahan, no? Pero a simpler one will just put some yung parang cream, yung ointment, no?
Okay. What ointment?
Ointment. I will kung saan ginagamit nila yung yung kasoy oil, kasoy ointment, no? Yung mga ganon.
Okay. I'll take it down.
Okay. So
okay.
So
okay.
it's not something to worry about, no? Okay. So it's seborrheic keratosis. Wag mo na sabihin wart. Seborrheic keratosis. So you read up on seborrheic keratosis. But
people who go near me, sorry. People who go near me say that they see the shape of a heart, which is, as far as I'm concerned, very flattering.
Mabuti pa, may shape of the heart. Shape of the heart, so pwede mo itago na lang yan. Maganda eh.
Anyway, thank you.
Okay. So
pero Doc, pwede rin paalis yan, di ba?
Pwede rin. Pwede rin paalis, or you can andali okay. If I have time, sandali madali namang I will show you keratosis.
If I were Susan, papaalis ko na lang kasi face yun eh, parang and maybe that will even lessen the risk of it escalating to cancer, di ba?
Hindi naman, pag basta alam natin kung ano siya, kaya importante yung diagnosis, no? If the diagnosis is keratosis, it will not go into to cancer, no? Okay, sandali ha.
I also had a big mole at the back of my neck, and I remember, si Dr. Marcos, Pacifico Marcos, the daughter of Pacifico Marcos, was my high school classmate. And when he saw it, sabi niya, Iha, alisin ko yung mole mo, sabi niya, kasi maitim daw, tsaka bakit ko raw papalakihin. So, kinoterize lang niya. So, bagay, the positioning is not so bad because maski magkaroon ng scar, nasa likod naman. Because it's difficult kung dito eh. Sa face.
Yeah. The first thing to do is to make a diagnosis, di ba? Okay. So once your diagnosis, it's not melanoma, it's something benign, then kasi kung melanoma, you decide on the treatment. Mas maganda operahan, di ba? Kung seborrheic keratosis, no? As mentioned, you can leave it alone, no? If it's not bothering you, no? But if it's bothering you, you can have it removed, no? When you say remove, that remove does not always entail surgery, no? It can put some ointment, no? Example, in this particular, can you see the picture, this one? Is it?
Yes.
Can you see it? Okay.
Yes.
So this is, Susan, parang ganito, di ba? Susan?
Yeah, but it's not, it's not as dark.
Yeah, pero rugged siya sa ano.
Yeah, a little rugged. Yes.
Okay.
Korting puso daw yung kanya.
Ito, anong shape ito? Anong shape ito? Anong shape yan?
Doesn't look so good.
This one, it actually is my auntie. My auntie, no? So, 80, ano na ito eh? 80 plus years old na eh, no? Okay. So, during the pandemic, I cannot do, ayoko namang i-subject to, to excision, no? Operation. Madali lang tanggalin yon, no? In one sitting. So, ang ginawa ko, I have this, somebody gave me this sample, tawag na, herbo cautery, no? Somebody gave me this sample. So, I use it, ayun, nilagay ko lang cream, no? Parang puti, no? Okay. The other alternative here will be the kasoy nut concoction, no? Okay. So, ito, yun. After some time, lumiit, no? Okay. So, and then, yun, paliit na siya. Ayun, paliit na paliit.
Nawala.
Okay.
Ano?
Eventually, yun, nawala, no? Yun, nawala, no? Okay. So, that's an example that you can have other methods of removing it if it's bothering you. Okay. Some of these, kumisan, kung maswerte ka, it just fall off by itself, nawawala kumisan by itself.
So,
Pero
every day, lalagyan ng ointment, ganun.
I have to do it kasi because of the pandemic, I just saw her once every 2 weeks or every week, every month, no? Nilalagay ko kaya hindi siya mabilis mawala, no? Okay. So, kung gusto niyo mas mabilis, probably every week, no? Okay. Anyway, I was happy that I did. I mean, it's we don't have to operate during the pandemic, no? Just put it, no? So, Susan, ano yan? Seborrheic keratosis, no?
Seborrheic keratosis.
So, dapat po talaga, i-consult yung doctor.
Yeah,
I mean, we should not really just depend on ourselves to diagnose, di ba? To self-diagnose us.
Yeah, but initially it can help once you know how it looks like. You can say, okay, most likely seborrheic keratosis, and then you just have it validated by a doctor, di ba? Okay. So you're now validating it with me. So most likely it's seborrheic keratosis. I can tell you, you can observe it. You can have it removed if you want. Okay, when you say remove, you can put some, yung hindi man formal operation, not may hiwa, na yung ointment, pwede na yun, na? Okay?
Okay, thank you.
Okay. Any more questions?
Pwedeng isa pa, Doc?
Sure.
Curious lang ako. Oo.
Sure.
When I used to go to the Cordilleras, I noticed that yung mga matatanda doon, they would chew nga.
Oo.
Hindi ba dangerous yun? Nag-yellowish yung kanilang teeth, no? But it could go more than that.
Yeah, oral cancer ang kalaban nila dyan. Yung nga o kaya inverted cigarette smoking. Yung pinapasok
Oo. Yung
diba?
oo. Ginagawa nila yan sa probinsya, yung mga lola.
There's a high risk for oral cancer. Yeah. Okay.
Okay.
So during my training years, my residency years, or even during my early part of my practice, I see a lot of these things, no? Okay. That I have to remove practically sometimes the whole mouth, no? Very disfiguring. Very disfiguring, no? So I always tell them not to chew nga, or inverted cigarette smoking, no? Okay. Okay. Any more questions? So none of you have experienced the thyroid cancer. Wala rito, no? Nobody has
Doc, ako yun. Natanggalan na ako ng thyroid gland.
Is it cancer? Papillary?
Yeah. Actually, that
Okay.
was in 1997.
Papillary.
Papillary. But
Okay.
I was thinking, why is it but my friend na nagkaroon din ng ganong thyroid cancer, hindi tinanggal lahat? Ako total. Ano yun, judgment call ng surgeon?
Yeah, judgment call, and also based on studies, no? Pwedeng conservative, no? Pwede ding total. When you say total, mas extensive, di ba? Okay, subtotal, baka yung sa kanya maliit lang, confined to one lobe, kaya subtotal lang siya kasi papillary naman, no? Papillary, the type of cancer. Kung follicular cancer, usually tinatanggal lahat, no? Okay, depende sa type, no? Okay.
Tinanggal lahat
Anyway,
yun sa akin.
yan nga. Pwede ding lahat, pwedeng but we just have to balance between yung mga benefit and the risk. Pag total kasi, fortunately, wala kang masyadong komplikasyon, no? Okay? Kasi mas risky yung total in terms of hypoparathyroidism, yung parathyroids na at the back of the thyroid gland, no? Kadalas maliit lang yun, hindi mahirap makita, no? Usually pag natanggal yon, no, magkakaroon ka ng hypocalcemia, magkakaroon ka ng mga cramps palagi sa kamay, sa paa, ganon, no? So, pero fortunately, hindi nangyari sa iyo. Okay?
But I had to take Tidin for life.
Yeah,
and my
because
voice, yung voice
your voice?
ko, yung voice ko, medyo a few decibels lower. I used to sing, but now not anymore because of that.
Okay. So may complications sa voice mo.
Yeah.
Okay.
Pero minimal naman yung complication. It's just that I was warned that it will be lower by a few decibels.
Okay. Okay na yun. Okay na, maganda pa rin.
Wala na ako magagawa, Doc eh. Nagawa na.
Baka malakas pa na yung boses mo naman eh.
Ganon. Okay, thank you.
Okay. So, sino po ba? So, thyroid cancer, isa lang meron sa atin. Walang nasopharyngeal, walang merong oral cancer, wala yung, ano pa yung isa? Oral, larynx, wala, no? Okay, buti na lang wala. Okay. So, questions? Saluta. I see a bet Saluta. Saluta, you have any question?
I have no question, Doc. Pero
Okay.
okay, Doc, okay lang ba? Meron pala. Regarding po sa thyroid nodules ko. Opo. Pero pinatingnan ko na po sa endo kasi baka po related sa mataas ko raw na sugar. So for testing po ako ng sugar na yung OJT, yung i-check po muna na walang sugar, then after 2 hours mag-iinom ng juice. Then nabanggit niya po na under observation po yung thyroid ko nodules. Yun lang po. Iniisip ko kasi noon, kasi nung last September, nung nagpa-ultrasound po ako, meron siya. Then, ngayon po, nung nagpa-ultrasound ulit ako, mas dumami. Pero sabi po ng doc, maliliit naman. May possibility po ba na yung pong sa history niyo po na pag dumadami is possible po siyang cancer? Hindi naman po.
Hindi sa dami. Okay.
Tyrant 4 po kasi siya eh. Yung malicious po siya ng Tyrant 3 and 4.
Hello? Nag-echo, no? Okay, nawala na, no? Okay, number 1, ang comment ko lang is, I don't think it's related to your blood sugar, no? Hiwalay yun eh, no? Okay. So, magkahiwalay yun. Thyroid, saka sugar is, mga pancreas, diabetes yun, di ba? So, wala yun. Walang kinalaman, no? Number 2, nowadays, because of the, may mga radiologists, they're reporting it yung mga thyroids. Lately lang yan eh, mga thyroids. It started with the breast BI-RADS. No? BI-RADS means breast imaging, yung mga system of reporting. No? Now sa thyroids, maraming overreading dyan. No? Okay. So they're just in the learning stage. No? So kuminsan, pero okay, anyway, it has to be correlated with the yung mga findings on palpations, ganon, no? Okay. So kadalasan, in my experience, maraming overreading, no? But from my personal experience, kaya hindi ko pinapansin mo na at kinakapapo lang mo na, okay? Kasi no kung wala pa yung mga thyroids yan, usually madadiagnose mo naman eh kung benign or malignant, no? Okay. So kung dumadami per se, no, it's not a sign of cancer, no. It just means that baka may mga hormonal changes lang yan, dumami, after another time baka liliit naman yan o kaya mababawasan, no? Okay. No. So kung ang diagnosis sa iyo will be probably multiple colloid adenomatous goiter. Yan ba? Yan ang binigay sa iyo? Unmute sarili mo. Unmute.
Actually po, Doc, ano lang po yung base po dun sa nakita ko po dun sa result is ano lang po siya, may Tyrant 4 and Tyrant 3 na malicious lang po siya, ganun na parang ganun lang po yung ganun lang po yung na ano po sa ano eh sa thyroid.
Ano sabi? Ento mo.
Ano po, observation lang po kasi maliliit pa naman. Yun lang po yung sinabi niya pero wala po siyang sinabi na ano kung ano po yung tawag doon.
Diagnosis. You have to ask her.
Po?
You have to ask. Kasi yung mga doctors, they don't usually tell you eh. No? They should be telling you what's the diagnosis. We always start with the diagnosis. Parang kay Susan kanina, pag pinapakonsult niya sa akin, may concern siya, I start with the diagnosis. Ano ba siya? No? Then we go from there. No? So, dapat you have to, part of my patient empowerment program is to tell you to do some advocacy to help entice the doctors to do what they should be doing. Okay. So they should be giving out the diagnosis, no? Okay. Para alam niyo kung anong basihan niya for saying na marami, wala mang problema, ganon, no? Okay.
Okay po.
So if I were the one taking care of you, I will tell you kung example lang ha, sabihin ko, what you have is multiple colloid adenomatous goiter. Okay? Basis noon, marami kang bukol-bukol, no? Okay, tama. You have more than
Apo.
one bukol. Okay? Regardless of the size, kahit na malaki, maliit, basta multiple, right away there's a so-called multiple, no? Yung wording na yun, multiple. And then titingnan natin yung mga itsura ng bukol mo kung meron bang cystic area, merong solid, di ba? Tama? May solid,
Opo.
may cystic,
Apo, may solid isoechoic nodules.
may cystic.
May hypoechoic nodules po.
Oo.
And
Complex.
complex.
Meron the word complex there.
Apo, smooth, complex,
Ayaw.
predominantly solid as isoechoic nodule.
So hindi pa kita nakikita at napipredict ko na kung anong meron ka. So, pag may complex multiple nodules, it's colloid adenomatous yun. Okay? Then goiter just means that you have a problem with your thyroid, no? So you diagnose, basta walang kulani, walang neck nodes, di ba? Kasi pag may kulani, that could be a sign of cancer.
Apo.
Okay? So kung wala, tapos multiple nodule, complex masses, your diagnosis is multiple colloid adenomatous goiter. Okay?
Colloid adenomatous goiter. Opo.
So, benign siya. Benign siya.
Opo.
So in that case, you have the options. Number one is a trial of medicine kung gusto mong paliitin, no? Okay? Or you can also take medicine kung gusto mong hindi siya lumaki, no? The third option is keep watchful waiting, monitoring, walang gamot, basta babantayan ng maigi, no? Ganun lang, no? Okay?
Thank you, Doc. Medyo nakahinga po ako kasi ilang doctors na yung naano ko kasi akala ko po related sa endo, sa ENT, ganon. So, wala silang diagnosis na binibigay. So, sa inyo ko lang po nakuha yung diagnosis at medyo nakampante po. Nakampante po talaga ako kasi iniisip ko na cancer na siya. Thank you, Doc.
Have I seen you before? Sino nag-refer you?
Lagi sa breast po, kayo po yung nag-aalaga sa akin sa breast. Kaya lang nung nag-pandemic po, nagtigil na po kayo ng online. So itatanong ko rin ng physical. So itatanong ko po din pala ngayon kung nag-physical or face-to-face pa rin po kayo.
Ay, oo, once a week, once a week ako nag-face-to-face.
Sige po, i-coordinate ko na lang po, Doc, sa secretary niyo.
Kaya nga, your name sounds familiar, kaya sabi ko, sino kaya ito?
Since 1992 yata patient niyo na po ako. Kayo po yung nag-opera sa akin opo, before 2000 sa breast. And then, minomonitor ko po yung breast.
Ang tagal na pala, no? Okay.
Opo.
So, paano ka naka-join dito? Friend ba tayo sa Facebook?
Opo, Doc. And then, lagi po akong tinitingnan ko yung mga post niyo.
Okay. So, welcome to this group, Pep Talk. Next week, I'll be talking, kasi Head and Neck Consciousness Week o month na ngayon, di ba? So, I'll be, last week, I talk about head and neck wellness. Now, today, we talk about head and neck cancer. Next week, I'll be talking on neck masses, mga bukol sa leeg. And then, to be followed by, diretso na, goiter, bosyo, and thyroid awareness. Okay? So, sunod-sunod yan. 1 month yan na thyroid, head and neck. No? So, keep in touch. No? Okay? So, sa ngayon, sa PEP Talk kasi, di ba, I think, who will vouch for me? husta polotan. 'Di ba? Ang sinasabi ko, all doctors should start with the diagnosis, no?
Oh, yes.
Experience ko talaga yung mga doctors, they don't give you the diagnosis, no? They'll just tell you, anong gagawin susunod? Anong susunod, na? Okay, dapat magbigay siya ng diagnosis, 'di ba? Tama? Yan ang tinuturo. Okay. So, it was borne out by Maria Teresa Saluta. Kita mo, hindi siya binigyan ng diagnosis, kaya ito loss siya. Diba? Okay. Any more questions? Perla, you're raising your hands?
Ay, doktor, hindi naman. Basta alam ko, doktor, you are a good doctor. Kaya si Teresa Salota, doktor, is my neighbor.
Neighbor mo.
Yes.
Okay.
Ngayon lang siya nag-attend kaya nagulat ako nung makita ko siya kasi ngayon lang siya nag-attend.
Wala kayong usapan.
Wala, doktor kaya nagulat ako si Tess pala yon siya ang kapitbahay ko.
Hi, Ate Per.
Hi Tess. Palagi ako nag-attend kay Dr. ROJoson every palaging 2 to 3.
Okay. So lagi ko rin gagawin kasi nung nakita kong neck and head. Kasi kung pati na neck and head kasama sa tinuturo ni Doc. So hindi ako aware kung ano, kala ko breast lang ganito. So wala akong idea na pati neck and head.
I will recommend sa kanya ka magpakonsulta kasi ako noon hindi sa kanya kaya 'di ba na-opera ako ng goiter. Multiple colloid adenomatous goiter yun opera sa akin total thyroidectomy. That was 1999. Sa Maddox. Sa Maddox din. Sabi ko nga kung si doktor noon, di ko alam kung natanggal lahat or napaliit ng gamot or ano. Wala na Tapos
ngayon ko lang nalaman, Ate Pearl. So, part pala ng part pala ng ni Doc is about sa thyroid and head. So,
oo.
Yung mga specialties ko yon, pero I can go all holistic. Yung ibang areas na hindi ko linya, pero I can coach you in terms of how to go about it, na? Okay. Sabihin natin, hindi ko naman linya, pero I will tell you how to decide what to do, na? Okay. A lot of times you miss yung you lack yung mga information from your doctors, na? Okay?
Mga iba doktor din yung diagnostic.
Maraming test yan. Okay. Okay. If there are no more questions, no questions anymore. So next week, neck mass, no? Then after that, I'm still preparing goiter, thyroid, no? Okay. So this will be, as I said, we will now we are on our 22nd anniversary for the PEP talk, no, by May 15. I have sent out a form for you, a survey to get your feedback. No, pakisagot lang. No? So probably tomorrow I will just send to you individually na. No? Kasi wala pa ako natatanggap na masyadong yung sagot. No? So I want your feedback on the PEP talk. So decide kung anong areas of improvement or kung itutuloy pa ba natin o hindi na. Ganon. So we are actually on our 94th talk na. This is the 94th na weekly talk. Na? Okay. So aabot na tayo ng 100. Na? Okay?
Okay,
Doc, nakasubmit na ako
Yeah, I saw you. Si Baby tsaka si Beth lang nakita ko. Kung meron pa ba iba. I-check ko mamaya ulit. Na? Okay. So, okay, we call it a day. Wala nang tanong?
No more. Thank you, Doc.
No more, doctor. Thank you po. Thank you, Doc.
Bye-bye.
Ingat po kayo. Thank you.
Bye-bye.
Okay.
Thank you, Doc.
Thank you po.
Thank you po, Doc.
Bye-bye.
Pilid mo nga anak, paano ba ito?